in. And we'll be seeing comments in the chat roll on the side, just like always. So how has your Tuesday been while we're waiting for people? Anything exciting happening?
A lot of fun rebuilding our place here in New York. So it's been fun getting all the constructions finished. That's always a lot of fun.
Yeah. Are you getting a storm the end of the week?
Well, so they said we were supposed to have rain all day, but we didn't. So hopefully that storm will pass and just warmer weather will come up. That would be nice.
They're threatening us with 5 to 8 inches of snow on Thursday night.
You're kidding. Wow.
Yeah. It can track very differently up here. And it all depends on if it drifts east and then Boston and the Massachusetts coast get it, or it's a little bit west and we all get slammed. Hi, Deb. Hi, Carol. See, people are finding us. Yeah. It's really funny. And Janet is way north of us.
Nice.
And she's waiting. You're getting the freezing rain sooner than we are.
Keep it.
Keep it. Yes, please.
Yeah.
Our ice is finally just melted, and now there's dirt, and the dogs are digging up God only knows what.
Yep, it's time to clean those paws when they come in the house.
Oh yeah, and I had yesterday. It was really nice out. I had a flock of Canadian geese going over.
Oh, sweet.
That's the first that I've seen. That's the harbinger of spring.
Nice.
Yeah. So welcome everyone. I am thrilled to be here at another one of our Facebook Lives as part of the Healthy Dog Expo. And my guest today is Olivier Morin of OneTDC worksSOwell, a product that hopefully many of you are becoming familiar with. Welcome, Olivier.
Thank you. Thanks for having me on, Dr. Lori. Looking forward to
Sure. So let's dive right in. I know a little bit about your company, but I'm thrilled to hear more about how you got started 10 or so years ago.
That's right.
With this amazing product.
Well, the history of it is pretty straightforward. We had this amazing product on the human side, OneTDC, as a pain cream, and we also had it as a supplement. And we're all pet owners, and in my case, dog lover. So we're like, we got to bring this to the animals. And what we realized is gum health or dental health was huge and a huge problem for small animals. I think most people know the stats. About 80% of cats and dogs by the age of 3 have some form of gum health issues. So we knew that we had something that could make a tremendous difference, while at the same time helping with joint health. So we had this one in the world type of product that could do both. So we're very excited, and it was very well received very quickly in the veterinary market, because they didn't have anything for gum health issues. So the history was human, which is a really good product on the human side. Athletes and just anybody aging and so forth would take it. But on the animal side, we just had this huge opportunity to help with gum health, working with veterinary dentists across the country.
And what class of compounds is the actual active ingredient?
Yeah, so that's a good question. So OneTDC stands for 1-tetradecanol complex. It's just a generic molecular structure. The derivative of it is coming from beef tallow, beef fat, which is great because that makes it very palatable.
Yes.
So it's not your common essential oil. It's a very unique fatty acid. It's actually a proprietary blend of multiple oils that we put together, and then we heat it. And when we heat it, it creates, I don't know how much biochem you want me to go into, but it creates this molecule that is completely different than fish oil, for example,
So it's not an omega-3. It's not an omega-6.
Not at all. It's completely different. And the subtlety is through the heating process, this molecule now has unique properties, which is very different than fish oil, for example. And those two key properties, one is they have an affinity for T helper cells, so the white blood cells.
Oh, nice.
So it's very targeted. It goes very specifically where the inflammatory cascade is. So at the same time, it's also very absorbent, transdermally, transmucosally, and then systemically, which you don't find that with omegas. So omegas have their benefits. There's no doubt about that. The only thing is you need a lot of it to be therapeutic. It's not the case with OneTDC because it's so targeted where it is most needed.
Mhm.
And the way, probably the way that Dr. Becker, Karen Becker, I know it's one of your friends
Sure.
and guests, the way she said it, it's a phenomenal product that promotes healthy inflammatory responses
Mhm.
from head to tail, because it goes throughout the whole body. But dentistry, it's a huge help because there was a huge gap there to help the animals. So that's
Well,
been our mission.
definitely, amongst the kibble dogs and such that we see in practice, we've got some dogs with serious dental problems. One quick question that came to mind, and also to Diane's right away, and I bet you get this all the time.
Yes, we
So,
do.
what's the deal with dogs that are sensitive to beef? Is it a
So,
problem?
Diane, thanks for asking. So, the first thing to remember about allergies usually derive from protein. So, one TDC, because we heat it at 400 degrees, if there's any form of protein, it'll be completely denatured. So, you should not have a reaction. Of course, we also say consult with your veterinarian, making sure to be comfortable with the full history, medical history. But I would just say try a little bit. Make sure you have no reaction. You could even dab it transdermally, and that's one of the ways of doing it. So generally, we get very good success even if they have beef allergies. But of course, use caution when doing it.
Yeah, yeah. And another one of our people occasionally breeds. Any concerns? And beyond any concerns, any benefits to the puppies?
Yeah, that's a good question. So, the truth be told, the disclaimer on there will tell you that we have not done research specifically in that case, and that's a disclaimer that you have to legally. The truth is, if you check with your veterinarian and your veterinarian say, "Can my dog have beef?" Or your dog that's breeding, can they have beef fat? If the answer is yes, you'll be fine. So it's very safe to do it. It's a
Yeah.
good question.
But what about dental development? Do you think it has in either in utero, or thinking of the nursing puppies?
So I
Would
don't.
it test out
Yeah,
in
that's a good question. So I don't have research that would say that first.
Mhm.
The truth is, if the mama has a healthier mouth, that's actually overall good for her health and passing that good health, going through for the pup. From a puppy being born after that, does it have a direct effect? I don't have any research that would say that. All I would say is make sure that pup, once the adult teeth are in, start the one TDC before you get issues.
So you start very young, just like we might start other joint support. Um, yeah.
Exactly. From a 100% prevention, you won't see results. You're preventing, and those cases, you don't do a loading dose. You go straight to a maintenance dose. But you
Mhm.
do have some, juvenile issues when it comes to gum health. So that can also be of value. Or if you have a dog that has a teething issue or if receding teeth or anything, it's a good idea to use the product for that. It'll alleviate the discomfort for sure.
Have you ever tried it in puppies with oral warts?
That's a good question.
Well, I saw one just last week.
You know what? I that would be more for my chief medical officer to answer that. That's Dr. James Anthony. He was a dentist. I actually don't know the answer to that question. I would definitely try, and you
Yeah,
can let us know. But I'll connect you with him. That's a really good
yeah,
question.
because some of these puppies that get oral warts, I mean, sometimes you might see one or two on the lips. Sometimes it looks like it's the entire roof of the mouth and all over the tongue.
Right.
And of course, then the puppy, as they eat, abrades them, and the puppy's bleeding. And they're not dangerous per se, but they're
Right.
a nuisance.
It's a nuisance. Yeah, I would think that from the mucosa and then from the tissues, you'll have healthier tissues by using one TDC. So I don't know that it will solve the problem, but could it make
Would it help? Yeah.
yeah, it's worth it, definitely worth a try for sure.
Wow. This is really, I never thought of that until I saw that dog last week.
Yeah, and that's a new one for me too. So good
Yeah.
for bringing it up.
So you actually, you harvest this beef fat. Is it U.S. in origin,
Yes,
or
it's
okay?
all US based. Yeah, everything in our company is US based except our immune product, which is from Japan.
Mhm.
And yeah, we're very careful on that, and we it's got to be. We need to know where the product is coming from. So
Where it's been handled.
absolutely,
Absolutely.
yeah.
Um, and so we talked about when to start. Um, do you often use it in conjunction with glucosamines and other joint support products?
Absolutely. So, and that's actually a really good question. It's a very common question. So some people will use some of the green lip mussels, some of the glucosamine products. In one TDC, you don't have any of those ingredients,
Right.
and vice versa. So what we generally tell people is if you're using a common glucosamine product and you believe in it and you've seen results, stay with that and add on the one TDC. First, glucosamine will do nothing for gum health, which is a huge
Mhm.
problem. So do both. And if it's a cost effectiveness aspect of it, some people like the one TDC because it's going to do more. You're going to do gum health.
Sure.
And I think one thing to stress also from a joint health perspective, one TDC doesn't just provide benefits for the joints. It's the complete orthopedic value. So you've got the muscles, the tendons, the ligaments as well that it's going to help. And of course the joints. So I think, multiple modalities is always a good idea. And you have to, with
Yeah.
your veterinarian, determine what's best, but combine it. There's no issues. Only one caveat. If you're using fish oil for joint health, what we do recommend is that you reduce the fish oil by half so that you don't overtask the liver in having just too much, fatty substance
Break
in the
down.
body. Yeah.
Yeah. Now, have you done any studies on, like dogs getting a TPLO for a cruciate tear?
Yeah.
Any comparisons, post-op recovery rehab?
Yeah. I have my own, and it's one clinical review
Uh-oh.
with CCL tears with my dog twice. We have research on the dog side that's been more on the joint health and quality of life and also observation. The TPLO part that you talk about, we haven't done a double blind specifically on that. We're looking at some of that actually. But the key thing is what we're finding, and a lot of that is also from orthopedic surgeons. So it's their clinical feedback. It's really important to start before the surgery so that you can really load up on the one TDC.
Mhm.
And then, of course, subsequently. My personal example with my little 12-year-old mixed lab shepherd, she tore both a CCL one at a time every year.
Of course, yeah.
And it's usually like that. Even though I did all the rehab and everything proper, it still happened. And the key thing, this is huge, especially for the folks in the dog sport, dog agility environment of fly ball, is to use it topically. When you use after TPL, the rehab that she's had, I would put it on topically on her knee, and she would also ingest it. So I was able to put a lot of the one TDC at the site, promoting very healthy inflammatory responses. And as a result, leading back to your question, what we did see is that she recovered a lot faster than what the canine rehab person would normally see. So huge value.
That sounds really interesting. And I mean, I think of, over the years, we see so many of these CCL tears. And it used to be we'd see one a month, and then it was two a month, and then it was one a week. And now I'll see multiple ones in a day.
I
That may be unique to the practice that I'm at.
mm,
But, if there was something that people could do proactively and then anything to make surgery recovery go better.
100%. One TDC just becomes one of your tools.
Right.
Proper warm-ups,
Yeah.
good diet, all those elements are so important. But that just becomes an additional tool to help. It really helps them stay in the game longer and happier and healthier. That's kind of what we pride ourselves is seeing older animals that are still competing and are healthy, so they
Yeah.
don't get hurt. So that's what that makes our day when we say that. See that.
Well, and certainly I think in the agility community, a lot of people are still running their dogs at 8, at 10, at 12, at lower heights, of course. But these dogs have been so well maintained in their early life that they can go do that. And then I look at my pet dog population, and at age 8, they're like, well, he can't jump on the couch anymore. And it's just such a night and day thing, the difference you can make being proactive.
100%.
And I wish we could reach the average pet owner more efficiently.
I agree with you because I think what I see also in the space of supplement, it's kind of a daunting task. There's so many different things out there.
Yeah.
And a lot of them are kind of Me Too products. That's why the agility community really gravitated to one TDC because it was different. Healthy
Mhm.
comes, helping with the joints, muscles, tendons, and ligaments. And it's a community that it either works or it doesn't. So we've
Right.
been around for a while. So that's a testimonial to what they're saying it's actually doing. And many well-known people that I've been endorsing it and encouraging people to use it.
Well, and we're talking about people that are on international elite teams, competing at world championships, which is, the doggy version of the Olympics, if you will.
That's right.
Brian has a little bit of a detailed question.
Good question.
Have you done any comparisons, or, I could imagine you are so much more concentrated than the food type sources.
100%. So Brian, that's a really good question. I think probably the easiest way to answer this is the bioavailability is it absorbs about 95% throughout the body. So it's very much bioavailable. What we're finding, though, is from a radio tagging of the molecule, we saw a higher concentration where the white blood cells activity is, but it does absorb throughout the body. So it's definitely bioavailable throughout the body. So that's a really good question, because most often, kind of what I said earlier, you need a lot of it for it to be bioavailable sometimes, or sometimes it still makes no difference. This is not the case with this product. It really is very targeted oriented where you need it most.
Have you ever explored it with tick-borne diseases?
Well, that's the best way I can answer this is anything that has an anti-inflammatory opportunity. This promotes healthy inflammatory responses. So again, I don't have a double-blind study.
Sure.
To say that. As a veterinarian like yourself,
Yeah.
you know, a lot of people that go well beyond what we even say on how to use it topically and very different opportunities.
I'm just thinking of, we see a lot of Lyme cases, a lot of anaplasmosis, and, whether systemically or topically, what a great tool. Now, you sell direct to consumer, right? Or do you sell through suppliers, pet suppliers?
Yeah, so our community at the very beginning was just veterinarians, but we quickly found out that the community of canine sports, they're very educated and they ask a lot of good questions like your audience here. So we made that available through resellers, through canine sports, and internet kind of made it kind of easier to have it accessible for people. So you can get it online. You just go to worksSOwell.com. It's pretty straightforward. And as a matter of fact, we have a discount for you guys for your show.
Ooh,
that you guys can take advantage of. Yeah. Just healthy dog 10. I'll give you 10% on any of your orders.
Oh, that's so nice. Thank you.
You're welcome. And that's going to be ongoing. So if you view this, 6 months down the road, I'm going to keep that active for you guys. So healthy dog 10.
Yeah. And let's see. Oh, and again, we know there's no double-blind study, but come on, get up there.
They actually, yep.
But are people, living in the real world trying it with other species?
Yes. So we do have a horse cream specifically that's very effective. So for Janet St. Pierre, you could definitely look at that and reach out to us. And sometimes it's not even on our website because we don't focus as much on the equine. We're easy to reach. Reach me. I'll put you in touch with our team. And that's something to use for sure and try. Topically, it's very effective for that.
What about cats?
Oh, cats.
Cats are their own unique species.
It's a huge product for cats. Matter of fact, we're published in the Journal of Feline Medicine and Surgery, double-blind study, peer-reviewed for cats. It's a huge product for cats because cats, there's two issues. One of them, they don't tolerate a lot of products. And second, it's hard to give it to a cat. So 1-TDC is very effective, it's very palatable. I mean, dogs think this is a treat. Cats are cats. Not all cats are going to think it's a treat, but there's different ways of giving it to where it's pretty effective. But for cats, yes. So cats get very severe gum health issues that this can help with. And the joints, people forget cats do get joint health issues too. That will be good. It'll do both for them as well. So definitely a cat product.
Yeah. Currently in the veterinary corner of the world, there are a couple of pharmaceutical companies really pushing arthritis awareness and products for cats. And I look at it and it's like, okay, we have another NSAID, we have another this. So I'm thinking, geez, maybe I need a few bottles of 1-TDC on the shelf
For the cats.
and for the cats.
Yeah, no, you're absolutely right.
Similarly to dogs, is it just once a day or twice a day?
Yeah, it's dosage based on weight.
By weight,
So
okay.
the product is a little, actually, I've got a bottle here. It's a little soft gel. I mean, most of your audience probably already know the product, but
Right,
it's
right.
a little heart-shaped soft gel, and it's a little heart.
Yeah.
You just twist it open. When you start, it's always a good idea for the first 30 days to do a loading dose. So it's one soft gel per 25 pounds loading dose. And then after 30 days, it's 1 per 50 pound. So if you have a border collie, it's 48 pounds, you always round up. You would give one a day after the 30 days. And then for a cat, you'd give one a day for 30 days and then just one every other day.
Nice.
Yeah. The exception to that is your athletic dogs. So those guys, once they get around the 7 or 8 or 9, they build a lot of lactic acid and you want them to recover faster.
Right.
That's what this will help with. And it's not unusual for those athletes to stay on the loading dose, particularly as they get older.
And any sort of adverse reactions or intolerances you've observed?
No, there's no known side effects to the product. It is a fatty acid. So the only thing we said to be careful with is if one of your patients or one of your pets has pancreatitis. Some will argue, well, it might be good for it. And I say, yes, but if I know my pet's got pancreatitis,
right, I'm not going to be, yeah.
And the great way to do it, if that happens, instead of putting in the mouth or on the gums, you would put on the pinna of the ear.
Oh.
And we do that with extreme cases of cups or stomatitis. You would put it on topically in the pinna of the ear, let it sit for 10 minutes, split it between both ears, and just wipe it off. So it'll go in transdermally, transmucosally, and then systemically throughout the body.
Nice. And of course, no problem if the dog or cat or horse, for that matter, decides to lick it off, because then they're just getting it transmucosally.
100%. And I'll tell you, one of a very common phone call that we do get is, oh my goodness, my dog cracked the bottle open and ate the whole thing.
Oh my gosh.
It happens a lot. So nothing happens. It's perfectly safe. They could potentially have loose stools. That can happen with very sensitive GIs, but it's very safe.
That is so cool. I could imagine the cats licking off a topical, and
some do, which really surprise cat owners. But cats are cats. One day they love something, the other day
they're going to do what they damn well please, and that's it.
Exactly.
So I'm looking here at my notes. What else do we need to answer here? We talked about the comparison with other joint support products. I always try to put my athletic dogs on some MSM. Any interaction with TDC with that, or?
No, it's perfectly fine. Yep, there's no issues. The only thing, and I think you had a question earlier, hopefully we answered that clearly, is if you're using fish oil, reduce that by a half is usually what we recommend. But there's no contraindications. If you're doing adequine injections, use 1-TDC in parallel. If you're doing laser therapy, a lot of your clients, a lot of your audience will use laser. Either they have one or they go to a practice. Laser is great. It promotes blood flow. It promotes white blood cells activity. Well, guess what? 1-TDC has an affinity for white blood cells. So if you do the laser therapy, then right after that, topically in that site, use the 1-TDC. And that will.
Or could you laser through the 1-TDC?
1-TDC is extremely transdermal. So it's its own carrier. It's both polar and non-polar, going through fatty tissue and water-based tissues. So as a result of that, there's no need to do that.
Okay.
It's better to do it after.
Do it after.
Yep.
Well, and I know certainly with our companion laser,
Yes.
if we're lasering any dark skin, never ever laser someone's tattoo.
Right.
It's an instant burn because the ink just holds the laser.
Right.
But none that doesn't happen with 1-TDC that we know of.
No, not at all.
Do it after anyway.
Yeah. I think one point to help your audience with that we get a lot of questions on is if I use one TDC, do I still need to do dental cleanings? And
Oh,
that's a very common question. So the answer is yes, because dental cleanings are very good at removing tartar and plaque and going very deep under the gingivas, removing the anaerobic bacteria. So the key thing that we tell people is use one TDC before to have really healthy tissues, and they'll have better comfort when they're done. And then subsequently, definitely.
after.
What we're finding though is that because if you have clean gums and healthier gums, the tartar and plaque generally will not rebuild as fast. But gold standard is still to brush your teeth or brush your dog's teeth every day, which unfortunately many people don't do. But it works very well together.
Now, what about when we're doing a dental, we have some extractions. Could I put a drop of one TDC in that tooth socket and around, the area?
That's a good question. You're full of dentistry questions. Look at that. This is great.
I
So,
am.
Dr. Anthony, who's used it with well over 10,000 patients, what he would do it afterwards. He would do his normal procedures, do a perio flap, whatever it might be, and then subsequently put it on. Now, he might put some himself, but he would tell the patient owners to wait 1 day. And it's not that the product will do anything. It's just that we don't hurt the area near it for the pet. But so not inside, wait afterwards from a transdermal aspect.
Okay. Because some of these, I've taken out a couple carnasal teeth, those big molars that your dog has, and it's got to be painful right after. And often we'll put nerve block in there.
Yes.
So the dog is comfortable, because, we're not giving them a bunch of drugs afterward. We're just using appropriate pain meds.
Exactly.
This could really take down the inflammation and help it be a healthier inflammation.
Yeah, and recover faster, right? That's one of the point in the research that we saw published in the Journal of Feline Medicine and Surgery. Some of the results there are quite phenomenal in helping the tissues. It even surprised us how effective it was.
Did you look at any cats that had full mouth extractions?
Yeah, so the refractory cases, those are tough ones. And often they've been under steroids and so forth, which kind of makes it worse.
Yeah.
So it's not the silver bullet. I wish it was.
Mm-hmm.
Very difficult cases. It's definitely something that a patient owner should talk with the veterinarians. What veterinary dentists do with those cases, they definitely use one TDC, and what they do actually, they double the loading dose.
Mm-hmm.
Check with your veterinarian to help. It's the same thing with the dogs. They get cups and so forth. So if there's anything we can do to help with the tissues being healthy, you want to use the product.
Yeah. And comparisons between kibble-fed dogs and raw-fed dogs. What do you see in their response to one TDC?
Well, I think, there's a lot of smart pet parents out there that are feeding their animals right. And by nature, when they do that, it will definitely help with the mouth. We know that. Is that a silver bullet for gum health issues? It's not. You have breed-specific animals that are just prone to it. So I think you don't want to put blinders and saying, because I feed raw, I don't have gum health issues. That's not true. That being said, I think parents that do that tend to have healthier attention on their pets so that they have less of a problem. Yeah. But so we'll get more results with poorly fed animals because there's so much more to help with. It helps both.
Yeah. And I mean, you mentioned breeds. I can think of Chinese cresteds probably as having the worst dentition out there.
Yes.
And I worked with a Chinese crested show person, and she would bring me, 5-year-old dog after 5-year-old dog. They were done showing, and literally the teeth were falling out. It was terrible.
And that's sad because it hurts. That's the part that breaks my heart.
And the level of infection in there and everything. And that's the kind of dog that you would start one TDC as soon as the adult teeth are coming in, right?
Exactly, 100%. I mean, anybody who does confirmation should be using this product because that's one of the first things that the judges are going to do is look in the mouth.
Yeah.
If you have a healthier breath to begin with, which is the nice side effect of this.
Yeah.
But, and to your point, it's like by the time the teeth are falling out, that means that the bone is eroded. It's too late.
Right.
OTC is not going to prevent that. What it will do, though, is help having a healthier mouth. But like you said, if you can do it preventatively, once by the time they're 6 months old, then hopefully you're preventing some of those issues.
Yeah. Yeah. Because it's sad for the dogs, and it's expensive for the owner too.
Indeed, that's the nice thing about one TDC. If you think about it, you're doing an oral health product, you're doing a joint health product in one solution, which is, if you do the math per cost per day, it's a lot less expensive than some of the leading joint products. So our goal is to make it accessible and affordable so that we don't compromise on our pet's health.
Yeah. So Carol asked about a product, and I have heard of this product called Teef, but I'm not really familiar with it at all. Are you?
I'm not. I saw that question, Carol. What I would love to know is, what are the ingredients that's in Teef? It's a cool name.
Yeah, well done.
Most, and I'm going to take an assumption that could be wrong on this. I would assume it's probably a tartar and plaque product. So, and I don't know if she's got more comments on that, but if it is, then yeah, this is completely. Think of oral health as two parts. You have tartar and plaques, and then you have periodontal, or what we call gum health. 99% of the products only take care of the tartar and plaque. One TDC takes care of the other half, which you don't have products for. Very difficult to find. So that's what this does. But I'm sorry, I don't know Teef specifically.
Carol says oh no, that's the other one. Look at this. It looks like it's a plant-based product.
Okay.
And
so
and you add it to the water.
Okay, yeah. So there are some products out there, few, but some that are quite good actually, with the tartar and plaque aspect of it, that our chief medical officer, who's a veterinary dentist, recommends. Personally, what I've seen from a tartar and plaque is the TD from Hill. They have those, the TD, not just as a diet, but just using one cable per 25 pounds to work on the abrasion. So the mechanical removal, that's something we recommend to do. It's very good to help with tartar and plaque.
The TD comes in these huge chunks, and it has a shell almost around it.
And it's meant for that abrasion to help with the tartar and plaque, which is good.
Yeah, definitely. Jennifer, hello from Jennifer from Volhard Dog Nutrition. I'm not sure, Jen, if you're referring to Teef or to one TDC. So if you can clarify that.
I can answer that with both concepts.
Okay, you go.
Yeah. So and this is a really important question, actually, because people ask us often, well, I'm going to use one TDC for a month, and then does it solve the problem? The reality is the root that's causing that inflammatory cascade usually doesn't stop. So especially if it's genetic prone. So as a result, is what one TDC does, it promotes healthy inflammatory responses. But if you stop using it, unfortunately, you're left with whatever was causing the issue to begin with. It's the same thing with joint health issues. Sadly, sometimes people find out, they get into a subscription, say, oh, I'll cancel, and then they call us back and say, oh my goodness, I didn't realize how much this product actually helped. Wow. So we encourage people to stay on it for as long as you think that you're going to have gum health issues. So it's ongoing. Yeah. It's
ongoing, definitely. Gail has an interesting question. This is a really dental-oriented group here. And I see a fair number of boxers who seem to be the prime offenders with epuli, which, for those who don't know, are kind of, think of it as an overgrowth of gums, where the gum would grow over the tooth.
Yeah. Well, I will tell you, my dog has that problem.
Oh no.
So, and I've had, our chief medical officer, shave the gums is what they end up doing.
Yeah, we cut them down.
The real simple answer of this is, if it's inflammatory based, it might help. The reality is probably not. What I would say is, do it more importantly if you have that issue, like my dog, because that becomes a very, very sensitive area that can be quite painful. So for Sasha, my dog was just sleeping over there on her little sofa. I do that every night. I brush her teeth, but I go very, very careful around that area because it's very sensitive. And I definitely make sure that she has one TDC in that area, which, by the way, One thing people often ask us is, well, should I put the 1-TDC on the toothbrush? The answer is no, because they love the taste so much they'll eat up the toothbrush. So
Well,
we say use it after and give it as a treat.
yeah, and that kind of goes along with Lily's question.
Okay.
1-TDC is not a toothpaste. It's not a tooth cleanser.
It's not.
So you apply it directly to the gums, not to the tooth.
Yeah, exactly. So I could even show you. I could probably have Sasha come up here and show you how to do it. The moment I do, she usually perks up. But what you want to do is it's correct. You want to put it afterwards. You put it on the upper gums and you squeeze it. You don't have to rub it in, particularly if you have a dog or cat for that matter that has any form of gum health. Stay away from touching the gums. It could be quite sensitive. Just pour it, and the soft gel is like a gummy bear to them. Most of them will just eat it right up. They don't need to. There's no therapeutic benefits to the soft gel, but it's completely edible and digestible for your pet. And
soft gel is not made of anything that a pet is likely to be allergic to.
Correct. Yeah.
Because I get those questions. Is there beef in there? Is there pork? Is there whatever? Right.
Yeah, no, it's very safe, the soft gel, and some people don't give the soft gel. I need to. Yeah, and the common question that people often ask us too, veterinarians ask us this question: say, if I put on the gums, is it going to help with the joints? The answer is yes. And why? Well, because the truth is it's very transmucosal. So you put very little of it on the gums itself to go through. Most of it is going to be absorbed through the GI and then systemically. So you really are doing the dual benefit by putting it on the gums.
Yeah, and we're starting to become more aware of transdermal, transmucosal means of delivery. And I just got an ad from a new compounding pharmacy that will basically make any medication into a transdermal, which, especially for cat owners,
that's huge.
That's huge, because then they can just rub it on the inside of the ear and you've medicated the cat.
That's right.
But it took a lot of my old time practitioners a while to be accepting of that. They're like, it can't work. But everything's connected, especially mucosally, so easy to absorb.
100%. And what's nice about 1-TDC is we don't have an extra ingredient to do that. The molecule itself is so absorbed.
That way.
That's one of the uniqueness of the product, especially on the human side when you use the cream. It feels really good. A lot of dog agility and flyable and canine sports use that because they themselves want to keep up with their dogs. So they use the human version of it to help them out.
Yeah. And Madeline brings up an important point. We can feed our dogs raw. We can give them all the best supplements. We can do everything humanly possible. The one thing we can't fight is genetics.
That's right.
And, sometimes we're not going to win, and that's okay because we've done our best part.
100%. And the question that Madeline has is it going to help if there's no teeth left?
Yeah.
Which is a good question. The reality is yes, because you still have gums, thankfully. You have a periodontal aspect which is what 1-TDC is going to do. It's going to promote very healthy inflammatory responses. And frankly, if you have a gum that's no longer, as much discomfort, it's healthier for the bone that's underneath as well. So the answer is 100%, Madeline. If you have a dog or a cat that's lost all the teeth for X reason, definitely use the product.
Yeah. And what's your take on black stains?
Will it help with that? I don't think it would help specifically.
And what do you think causes them?
That would be a question for our chief medical officer, who's a vet dentist. The big thing that I ask for is not just on the tip of the tooth, right? Is what to do with that, and is it bad? And the best answer that I've received from experts like Dr. Anthony as a dentist is if it's soft and it's something, and you don't do that, you go to your veterinarian to do that. But if it's soft and it goes through, yes, you have an issue. But if it's solid and it just happens to have a dark spot, that's fine. Yeah, that's the key thing.
I have my oldest dog is a force of nature, and no closed crate door is acceptable in his world. And it doesn't matter if he's inside the crate or outside the crate. So one time I had left a chew bone inside the crate and latched the door, and he's dragging the crate across because he wants the bone.
Wow.
But he has worn enamel off his teeth. He has worn the tips off teeth. We see these black things. The teeth are in there solidly.
Wow.
Non-painful. You know, in a perfect world, yes, I would take them off, but I just haven't gotten there because he's totally functional. No abnormalities I can observe to the gums. And I wonder if Lilly might be seeing the same sort of thing, or the rock chewers,
Yes.
rock carriers.
Yeah. And one plea that I would have with people is around, and I know I'm not going to be popular for saying this, but antlers. I know antlers are very tasty and very attractive to dogs that love them because of the salt, but it's really bad for them. And vet dentists see so many broken teeth, which are very painful because as a result of that. So just a little plea, if you're giving antlers, really think twice because it can really, really be painful for them. And it's so hard. Dentists basically say, if you can't bend it, you really shouldn't be giving it.
Yeah.
Because it's a question of timing when you'll have a fracture or broken tooth.
And, maybe you can get away with it with a very casual chewer.
Right.
But not my dogs. I mean, I would never do antlers because they would try to break them in half. That'd be it.
Yes, they do.
And having had a dog with a slab fracture of the carnasal tooth, that pain, it was bad. Poor guy.
And they're pack animals. So that's the other thing too, that often as pet parents, we forget. Not all, but many of the animals will not show the pain. They're packed. They don't want to show it. So it's not unusual for them to have discomfort in the mouth that's just not addressed. And fractured teeth can be definitely one of those. So if they're eating less, that's usually a sign. Right?
Yeah. And sometimes you can't tell until you remove that tooth, and all of a sudden the dog is miraculously happier.
Yeah, we've heard that quite a bit from Dr. Anthony.
Yes. Ellen has an interesting question that we haven't talked about. Root resorptions.
Well, so from a bone structure, from a root standpoint, again, if it's something that's causing that from an inflammatory aspect of it, 1-TDC will promote healthy inflammatory responses. We have seen in some of the research actually that it also promotes osteoblast activity. So it's actually very good for the bones. To go to the point where it's going to prevent that from happening, I don't have a double-blind study to say yes. Mm-hmm. Would I use the product for that? Definitely will, with your veterinarian's permission, of course, in review.
Yeah.
But the gums themselves around the tooth will definitely be healthier holding that tooth in, though. That's one thing that you will get benefit from the product.
Excellent. This is one of my pet peeves. Benny bones and the, what would you call them? The totally artificial, sugar-laden dental chews you find in your average supermarket.
Yeah, we won't name them, but yes.
Yes, I mean, there's probably too many to name.
Yeah, and the sad part is the animals love them, but it's not good for them.
Well, there's half the time there's sugar there, there's rice flour, there's sugar, there's starch, there's grease of some type binding it together.
Yeah.
But I've never actually seen them crack teeth, but they certainly don't have any benefits that I could possibly perceive.
Yeah, I would agree. I think I'd be very careful what I use to tartar and plaque.
I know the 58 people who are watching this right now are not going for Benny Bones, but share with your friends, your family, the people who don't know better. Steer clear. Greenies were, I think, one of the first to come out. And did you know greenies are actually nutritionally complete to AFCO standards?
Yes.
Because, of course, you would nourish your dog with greenies. It's just crazy. It's just,
you had a question from one of your viewers about the fatty acid and if there was any form of fish inside of the product.
No.
I'll be happy to answer that question. So there's no shellfish at all in 1-TDC. That's usually one of the concerns from a allergic standpoint. There's a little bit of salmon oil, wild Alaskan salmon oil, and we test for iodine and all the different things. So there's a little bit of salmon oil in it, just in case if someone has a concern for fish reaction. But there's no shell fish at all in it.
Good. I did see a couple of questions. Shaleena, I hope I'm saying that right, wants to know about shipping to Canada, and someone else asked about Australia. Any plans to go international?
It is international. It's in Japan. It's in South Korea. It's in the Philippines, parts of Europe as well. Unfortunately, we cannot ship to Australia. They have strict regulations of products that have beef fat sources. We have all the BSF reports. We have everything because we ship in Japan and a lot of different countries for years. But Australia or New Zealand is just one tough one.
Yeah.
Canada, we do ship to Canada. We have, you'll see that on the website. There's a flat fee, shipping fee. I can't still understand our neighbors why it's so expensive to ship to Canada, but unfortunately it is. But we do ship to Canada. Yeah.
Perfect. And can we just hit the cats again real quick? Margaret joined late. Just the 2 minute of where do I get it and how about my cat?
Yeah, so to get it, just go to worksOwell.com. Make sure to use your discount code that we created just for Dr. Lori's audience. So it's HealthyDog10, 10, all one word, and you'll get 10% off. And for cats, 100%. The bad breath is one of the signs that we see, but that's usually an underlying condition that you should check with your veterinarian for sure. But beyond that, 1TC definitely has a lot of help with that. Would it help with tartary plaque? The reality is we're so focused on the periodontal, the gum health part of it. That's what our focus is, that we have actually not focused on the tartar and plaque, but we do know that you do get a reduction from it, but that's not our focus. Yeah. And maybe as a veterinarian, one of the common questions that we get is it VOHC approved? So that's the the Council for Oral Health for Animals certification. We can't get a certification because the product is for gum health, not for tartar and plaque. Right. So our chief medical officer used to be one of the pioneers at VOHC in the council, and they couldn't do it because it's a gum health product.
Makes sense. Well, as we're coming up on the hour, is there anything we haven't covered here? Anything else that people really need to know?
I think we covered a lot.
I think we did too.
Yeah, I think maybe the recap is use it preventatively. Definitely use it if you're doing any form of dentistry work, or if you can't do dentistry work. Sometimes that happens. There's certain breeds where heart conditions are concerned. Athletic folks, 100% for recovery, stamina, oral health, and joints. Do it for sure. And if you do any form of orthopedic work, don't forget this is a fantastic product for recovery after surgeries. And one little trick people love to hear about this is, especially the dog agility people, is when the paws get ripped, what you want to do is you clean it up and then you put 1-TDC topically. It's phenomenal for helping recovering faster for those.
Oh, nice.
Yeah,
nice.
It's completely off-label, but we've learned that. Actually, I think it was Susan Garrett that was telling us about this.
Yeah. That
she had heard that and she had done that, and they said that it's really remarkable for that. So we actually learned from you guys directly.
Yeah. Well, we all go off-label sometimes and find out something that's really, really cool. So people were asking about the website. Yes. So it's worksOwell.com.
Yeah, and you forgot an S actually, Dr. Lori. It's worksOwell.com. There you go.
Thank you. Janet's got my
Janet's got you covered. And just look for the animal side part of it. And
order the human side for yourself if you're going to be running your dog.
Use that cream. That cream is phenomenal.
Okay.
Yeah, that cream, like if you're a dog agility person and you're going to do multiple walks and runs, more importantly, do it before you do that. In the morning, do your runs, and at the end of the day, put it on again. It really, especially if you're doing like multiple days trials, it really helps you stay in shape and recover.
Terry has an interesting question that I hadn't thought of, but hyperbaric oxygen is becoming more common.
Yes. Yeah, that's a great question. That's a good question. I don't have a double-blind study to show that. The logic would be, though, because of what you're doing with the hyperbaric chambers, I would definitely do it after. I wouldn't do it before. I would do that treatment first, and then subsequently, I would do the 1 TDC after, and give us some feedback.
Yeah.
That can definitely can help.
The other thing that, of course, is super hot right now is ozone therapy. And I know there's got to be somebody out there who has ozonated 1 TDC. There just has to be. Has anyone brought it forward to you?
Well, we have not ourselves. I have not. If one of you folks have, please get a hold of us and give us your feedback. But we have not. But you're right. It's getting increasingly popular.
Yeah, and appears to be helping a lot of animals. Deb says, Deb is a fan. She says the cream is fantastic.
Thanks, Deb. Good to hear from you. Great picture, by the way. Love that shot.
Oh, that is. And Olivier is a talented photographer.
Thank you. You know what it is? I just love the bond that we see, those agility and flyball and canine sports. It's just that relationship is just so awesome. So it's just like a privilege to be able to capture that and just and to share the pictures. So it's our way of saying thank you for being so good to your pets or your athletes.
Well, and these dogs are phenomenal athletes that are living in the moment of whatever their activity is. And I just love seeing that.
I do too.
All right. Well, Olivier, thank you for sharing this time with us. A lot of people are asking, are you coming to the expo? I know the answer to that yes, you will be there.
I wouldn't miss it.
Will you be bringing product, or will you have an ordering system for people?
We'll bring in product because usually it's nice for people. They want it right away. I'll bring both. I'll be there personally. I will be there, bring the product. I'll bring the human product as well because people do appreciate that. And I usually bring samples so they can test it right then and there. And I'll bring my camera. So it's always fun to do some headshots of your pets.
Definitely. All right, guys, last call for Terry is going to be trying the hyperbaric at All Creatures Hyperbaric Care. Awesome. So Terry, I don't know if you're coming to the expo or if you're going to email us or what have you, but we definitely want to hear about that and hear what your experience was.
I look forward to that. Thanks for thinking of that. That's what we love about this community. You guys come up with things we don't even think about. So that's fantastic.
Definitely. All right. Well, guys, we're going to sign off. I will be back on Thursday with Melissa from Four Legger. So we will have more education for you this week. Thank you for joining us, and I look forward to seeing you down the road.